There's some important news that has just come out of the FDA with regards to a number of children who died because of the COVID vaccine. Now, this is big news, but expect that they're going to fight this with tooth and nail all the way to the end because the implications are so serious. What I'll be taking you through quickly today is the letter or the email that was done by Vinay Prasad. And I've highlighted a few points in it that I'll take you through and just give you my thoughts as well about what is happening and what I think the implications of it are. This is important stuff. And what seems to be coming out is that our regulatory agencies were not very thorough when it comes to looking for problems. And what that means is that fundamentally, you are on your own with regards to the outcomes. And I've seen this very clearly when it comes to just vaccine injury across the populations, wherever in the world. It seems to largely have been ignored with regards to the COVID vaccine. And it was because it would damage the narrative. Now, the importance of all of this lies with the fact that in reality, we have to make sure that there are solutions available for people. And so before I start, I have decided to do something unusual, which I mentioned just a few days ago. I am going to try and train people with some basic knowledge about how to help others in the pandemic. And so I've put together what is called a stand store. I've put it together. The moment it only has one thing, I'll add something else soon, but it's about joining a community with a monthly pass that's paid, but there will be a free explanation for those people who don't want to pay to join. And part of the reason why there is a payment is because I need people who are going to take this seriously, because I'll be giving you information that normally I'd only share with my medical community. It's just that some of the work I'm doing without an understanding of what's happening with regards to the pandemic and without a real interest, there doesn't seem to be an appetite for it. And so what I've realized is that people in the public are on their own. You need to understand what is going on. I'll try and put it in a framework, as you know, I like to teach, where I can break it down into easily digestible parts. If you want to join this work and this process, please look in the description. You'll find the link there. So let's get back to this point about what exactly happened. And to give some overview, you first have to understand who has done this message or email. Vinay Prasad, he is currently the Chief Medical and Scientific Officer for the Office of the Commissioner Director, Center for Biologics Evaluation and Research, CBER. So he is an oncologist and has been pretty vocal with criticizing some of the things in the pandemic. So he wasn't particularly liked before RFK went in the US. And so a lot of people were not happy that he got that position because they said that he was, in a sense, anti-vaccine for asking questions. Anybody who asks questions is anti-vax. This is how it's being framed. So he is the one who is leading this bit of research. The second person I want to highlight, because she's mentioned, is Tracy Beth Hogg. I don't know if I've pronounced that correct, but she's a senior advisor for clinical sciences in this CBER. And the CBER has a number of about 450 research scientists who do a lot of work in terms of trying to understand what is happening in terms of drugs and vaccines. And the reason I'm going through that is because they've mentioned a word that I think you need to understand, and it is here, OBPV. It's Office of Biostatistics and Pharmacovigilance, which is part of CBER. So this is the framework that you have to to look at. And so he is writing to his team about some information that has been brought to his attention. So some of the career staff, for which he had mentioned Tracy later on, found that at least 10 children died because of receiving COVID vaccines. Now, the first thing you have to think there is, why are they talking about 10 children dying? Well, it's important because nobody really has ever acknowledged this. And this is a problem because part of the argument for why it was okay for children to receive the COVID vaccines, even if they were low risk, was that even if they were low risk, there was no risk, so to speak. And myocarditis is rare. Don't worry about it, you know. But to find that 10 children have died because of the COVID vaccine really changes the risk benefit equation. So another point I highlighted here was that they mentioned about in terms of vaccine-induced myocarditis, but they pointed out that with the COVID virus, there is a steep age gradient, being at least 1,000 times more likely to kill an 80-year-old rather than an 8-year-old. This is very important. And this is something that we had argued about very early on when they were starting to or plan to roll out vaccines in children. It was well known that children were really low risk. And in case people's memories don't quite work the way they did then, you have to remember that statement. People were being vaccinated, even children, to protect granny. It wasn't because anybody was concerned about their child getting COVID. You have to remember that. Remember, parents took the vaccine before giving it to children. What that indicates is that parents were not concerned about their children getting COVID because we all knew it was pretty minor illness. Now, it's important to note in the Omicron era, this has changed a bit, and that's a whole different discussion as to why and whether or not the broad vaccination put children even at higher risk later on. But that's a different point. But for the time being, don't forget that if you had children running about, you weren't concerned about them getting COVID. It was about them getting COVID and passing it on to granny. That was the thinking at the time. So when you look at that, you can see here that the myocarditis signal then started to come out with regards to healthy young boys and men. And it's important to note that, firstly, the myocarditis signal was considered to be misinformation. So they denied it at first. And then when it started to come up around the world, they go, okay, it does happen, but it's really rare. Don't worry about it. That, in effect, was another important transition point because they were giving the impression that if myocarditis occurred, even because of the vaccine, it wasn't significant and it was relatively rare. And that point was made when the prior CDC director, Rochelle Walensky, stated, "We have not seen a signal, and we have actually looked intentionally for the signal in over 200 million doses we have given." It's a signal for, I guess, myocarditis or mortality. Many felt this statement was dishonest and manipulative. So this is where he is. And then he mentions Tracy. So his senior advisor, myself and colleagues were looking in more detail at all of what was happening, especially in young men. And it's important to note when people talk about the safety and it being rare, my argument at the time was that they were only looking for myocarditis primarily in people who presented to their doctor or to hospital. But many people may have had chest pains, palpitations, not really thought too much about it, or just thought it was a side effect. And those cases could be subclinical myocarditis, where it doesn't have as significant symptoms. And a study in Thailand, which again caused a huge ruckus at the time over 2 years ago, found almost 1 in 3 children who were vaccinated had some kind of abnormality, whether it was ECG, myocarditis. It was 1 in 43 who had myopericarditis. So these were important pieces of information that really went over, I think, under the bridge, so to speak. Then the FDA delayed acknowledgement of the safety signal of myocarditis until after it could extend marketing authorization to younger boys 12 to 15. I'm telling you, the longer this goes on, the worse it's going to look. I'm going to give you an example here to let you understand what is happening here. If you remember the Iraq War in 2003 and the problems that occurred with Tony Blair, say in the UK, when they made the announcement about Iraq having weapons of mass destruction, and it turned out that that information was not correct. What was important was that they knew it wasn't correct, but they positioned it so that the public largely would agree with going to war because there was a lot of resistance against it. My analysis, and this is me, don't take this as fact, this is my analysis. My analysis was that the UK government was in a difficult position, and so they made the decision to do that because they anticipated that the war was going to be quick. So it should be over in about 3 or 4 weeks. They'd take out Saddam Hussein. Everything would be fine. No problem. They would apologize for the fact that they didn't find weapons of mass destruction. That's it. It then didn't work out like that. And this ended up to be a protracted war where a lot of people died. That then became a problem. So follow my analogy here. In the same way, I think people overlooked some of these things because in their mind, they thought, listen, this is a pandemic. Don't worry about any signals. Let's just get past it. We can come back later and say, listen, maybe there are a few problems, but look at how wonderful everything is. The pandemic is over. That didn't happen either. Now they've got a problem because now not only is the virus still circulating, mortality still seems to be up. Everything is up in the air. This is like the worst piece of news that they could have heard. And so when Tracy, Dr. Hoig, began investigating in the summer of 2025, she was looking at the VAERS reports of children who had died after administration of the COVID vaccine. And by the late summer, she concluded that there were in fact deaths, a fact that the agency had never publicly admitted. So this is now coming through 4.5 years later. It's almost like what happened with thalidomide. I don't know if I'm allowed to say this, but the company only made the apology in 2012 after what happened in the 1960s. They denied that there was any problem. And eventually in 2012, they said, actually, yes, there was. This is how things usually work. So what they did is that they took an analysis of 96 deaths between 2021 and 2024, and they concluded that no fewer than 10 were related. And they think this was a conservative coding, where it wasn't that they didn't think the vaccines couldn't be contributory, it's just that they weren't as sure and it was a little bit more ambiguous. I would love to see the details of every case, because when I take a clinical head and look at it, I'm looking for whether or not there was a temporal relationship between the vaccination and the death, whether or not there was any underlying comorbidity that could have contributed to death, and whether or not there were any other unusual symptoms that were predating the death. And my rule is very simple in terms of COVID-related complications. If you haven't found any other cause, usually in the context of medicine, we say the most likely cause, therefore, is so and so. That's how we usually do a death certificate. So in this case, if I looked at the 96 cases and I couldn't find any other cause that reasonably would be the explanation, I would therefore, if I had to write a death certificate, would have to say probably would have been vaccine related. So this is why I said that it's likely to be way higher than 10. But again, without the details, we don't know. So he goes on to say, for the first time, the US FDA will acknowledge that COVID vaccines have killed American children. Healthy young children who faced tremendously low risk of death were coerced at the behest of the Biden administration via school and work mandates to receive a vaccine that could result in death. Now, and that should have been communicated to parents. There's no doubt about that. And I think that when we look at the science here, because sometimes I wonder what in the world was going through their heads. I think people were so scared and so determined that they had to get beyond this, and so confident of what they saw in the science, possibly without reading the paper in any great detail, that they felt that they could push this through because it was such a big political win. I think politics and finance played a huge part here. And my personal view is that in 50 years' time, when we look back at this period of time, politics and greed will turn out to be the reasons all of these things fell apart. It's quite remarkable because I've always worried about the technology and how it was used. But if they had just focused on the high risk, I don't think there would have been any questions that could easily have been raised because it would have been so difficult. But when they broadly gave it to the population, including the low risk, suddenly anything that goes wrong, it's not hard to put together. So he goes on to say, putting these facts together, it is horrifying to consider that the US vaccine regulation, including our actions, may have harmed more children than we saved. He uses a may because when they go down, they realize it's not so easy to specifically delineate how many children were saved or harmed. But without a shadow of a doubt, the fact that children were harmed does indicate that the risk benefit association was probably not worth it. Another point that I'll make is that there were people who had concerns. Doctors Gruber and Cross resigned in 2021, and they were running the vaccine division for decades. They resigned over two issues: that Dr. Marks insisted that annual boosters should be for all people, irrespective of age and risk, while they preferred a risk-based evidence approach. Okay? But they still pushed it through with regards to the boosters. I still think that Gruber and Cross were partially right. They should have done it for high-risk patients only who had not been infected. They shouldn't have. It doesn't seem that they were against mandates, which I'm pretty sure is going to come back to bite everyone. And so when we look at everything here, you can realize that this is a disaster that's unfolding. And this is just the beginning. This is why I'm saying to people, whatever you do, if you haven't pivoted yet, this is the time to pivot and say, oops, I think that maybe this was the wrong thing to do. I'm just, even then, I don't know if pivoting now will save the public perception of how things are. But if you don't pivot, you are definitely going to be in trouble because the dam is just starting to break. And this kind of information is going to raise a whole bunch of other questions. And here is one of the final thoughts here that I'm going to highlight. Additionally, at the FDA, we have not been focused on understanding benefits and harms of giving multiple vaccines at the same time. I highlight this because I remember when they were starting to give the COVID and the flu vaccine at the same time. I was thinking, why are you doing that? Because this is a relatively novel technology. novel virus. You don't know how things will work out. If you put them together, if you have thought that the flu vaccine was safe before and there are problems with the COVID vaccine, how are you going to differentiate it? And I realized at that point that they were so either confident or so determined to push this through that they just were not thinking logically. These are huge issues that have to be addressed. Now, the final point is this. Take into consideration that the FDA has come out and said this. Wherever you are in the world, you have an equivalent organization looking at safety, pharmacovigilance of drugs and vaccines. What were they doing? Is it that the FDA runs the world? What are these other regulators doing? Do they just take the information from everyone else and don't check it themselves? And this is an important point because sometimes they trust the manufacturer to do the pharmacovigilance, to do the work, and to see if everything is safe. And if it isn't safe, it will then, in theory, go back to the manufacturer, but it can't in this case because they have liability or liability protection. This is a disaster, and it's only just starting to unfold. What I'm waiting for is the autopsies, because in my view, that's the only way we can potentially mitigate some of these issues. We've got to understand what is going on, why so many people are sick, why so many people are still dying. How can we mitigate this? How can we make a difference? And as I warned you before, you are in this boat on your own without any oars. It doesn't seem as though anybody is coming to help you. They are just going to leave you floating there in the water. That's the reality. So, with that in view, for those people who are willing to try and learn and understand, I can only share my knowledge, my expertise. And if you want to come on that journey, look in the description, join this Stan creative thing. It came as a moment of inspiration for me just this weekend. This is why not everything is put together. I just thought I've got to help people to be able to help themselves, because we need now the community to protect the family, the loved ones, and everyone else. This is especially an important call to the unvaccinated. I know a lot of my listeners are unvaccinated and they appreciate the updates, but you need to do more than that, because for people who are struggling, they don't want to acknowledge that this is the issue or this can be an issue. You need to communicate properly, you need to educate, and you need to find ways to help. That is your contribution. Don't worry about being right any longer. I think they all recognize it. They just won't tell you. Let's see if we can work together to try and make them better. Have a great evening.